Welcome, and thank you for joining us for today's webinar. Today's webinar is on the use of medical cannabis for symptom management in scleroderma. As you know, we like to do these webinars monthly. They're a great opportunity to get the community together, get the community involved, and for you to ask kind of all those burning questions. And we got a fantastic speaker today, Dr. Elizabeth Vukin. But before we get into the webinar, I'd like to just go over a few kind of housekeeping things just to make sure everyone's connected correctly and is going to have a great time during today's webinar. So everyone should be connected now. If you're connected properly, you'll be able to see myself, Dr. Vukin, as well as a slide, an introductory slide on the screen. If for whatever reason you can't see one or you're not picking up audio or it's coming in choppy, please try logging out of the Zoom and logging back in. If the issues persist, you can message me directly in the chat and I'll be able to assist you from there once the webinar has begun. If you're viewing the webinar on a handheld device, a tablet, anything like that, you'll likely need to actually scroll left or right to be able to see the presentation versus seeing the speaker. With that, this webinar is scheduled to be about an hour in length. We are recording, so if you happen to miss anything or want to review any of the materials, this webinar will be recorded and will be posted to our YouTube page. That's Scleroderma US. And that'll be posted on Friday of this week. If you have any questions throughout the webinar, please feel free to use the chat or the Q&A feature. I'll be monitoring those questions, and at the end of the presentation, we'll be going through a Q&A section. So please feel free to drop those in throughout. Make sure you don't kind of forget those questions as the presentation goes on. And lastly, I just want to go over our disclaimer quickly. So the National Scleroderma Foundation in no way endorses any drugs, treatments, clinical trials, or studies referenced in this session. Information is provided to keep the community informed. Because the manifestations and severity of scleroderma vary among individuals, personalized medical management is essential. Therefore, it's strongly recommended that all drugs and treatments be discussed with your healthcare provider. And you want them through proper evaluation before doing so. With that, I'd like to introduce our speaker for today. Our speaker is Dr. Elizabeth Vukin. Elizabeth Vukin is a pediatric physician for the last 20 years or so. She was based out of Utah with a special interest and education as well. And I think this is kind of extra, special, and I think, really ties her, of course, to the communities. Dr. Beth Vukin is actually living with scleroderma as well and has been for multiple years now. And so this presentation, not only is it coming from somewhat of a medical background, but also lived experience with scleroderma. So with that, I'd like to pass it over to you, Dr. Vukin. The floor is yours, and thank you again for joining us.
Thank you so much, Angel, for having me, and thank you for the National Scleroderma Foundation for having some interest in this topic, and I'm delighted to be able to share some information with you today, not only as a physician, but also particularly as a scleroderma patient. So I've got a couple of disclaimers to start. First, I'm going to be talking about the use of cannabis, and so that is a topic of discussion, right? There's a lot of different opinions about cannabis, and so we'll come into this. I'm here to provide you with information. Again, this is strictly for informational purposes. This is not to be taken as medical advice. Even though I'm a physician and I'm a patient, I'm not your physician and I don't live in your body. So with all things with scleroderma, please discuss this with professionals that you are comfortable with. I'm also going to be talking about off-label usage. And what that means is we're talking about the use of cannabis for something that it may or may not have been studied extensively for. And I think for those of us living with scleroderma, we all become all too familiar with the fact that scleroderma is a rare condition. And there are a lot of things, probably everything actually that's used in scleroderma is used off-label. It's been used for other conditions that are similar, but not necessarily studied in scleroderma. I will say, though, we're going to be talking about the literature on the use of cannabis in similar conditions, particularly things like multiple sclerosis, rheumatoid arthritis, and other common shared symptoms that are with other disease processes like cancer. There we go. I also, I have no conflicts of interest. I'm a physician by training. This, again, is not to be taken as medical advice. I am presenting this information as an educated patient for the community, strictly as, again, as information. I'm a volunteer. I don't receive any payment from any manufacturers of any products, also not from the Scleroderma Foundation. I don't receive any payment from anyone, actually. I do host 2 podcasts for which I receive no funding or support, and the views and opinions on the podcast are my own. And then one more disclaimer on cannabis. Cannabis is not for everyone. It is a drug and it is a medicine, and we should talk about it as such. People have really different reactions to cannabis, and it can be used in a strategic way for symptom management. I'm really talking about this for symptom management. There is some emerging scientific evidence about disease modification with cannabis, but really what is known at this point in time is for symptom management, and that's what I'm going to be talking about. The other disclaimer is there is a lot that is unknown about cannabis, and there are risks associated not only with use of what is known, but also the unknown. And so, again, this is for information purposes only. I'm going to be talking a lot about cannabis, and I want to have you as an audience think about this much like we think of other available, potentially addictive psychoactive substances. So those are things that are available to you that you take that have some sort of impact on mood, cognition, focus, pain, things like that. So the things that I listed there, caffeine, opiates, nicotine, alcohol, all of those actually are plant-based. We get those substances from plants, and we use them in different ways, and we use them in strategic ways, and they can be abused, and they can also be really beneficial. And so let's think about cannabis like that. So first, we're going to talk about safety. Cannabis is a drug, and it's also a medicine, so it should be treated as such. And so I'm going to come at this with the assumption that should you be using cannabis, that you are of legal age to use it, are legally able to use it, whether that be in a state where it is legal to use recreationally, or if you have a medical card. You're using a regulated product from a licensed dispensary. I don't think that I necessarily have to go into, you shouldn't be getting your medications off the black market. You shouldn't be buying it off of websites. You shouldn't be buying it off of people. There are a lot of dangers inherently in that. So let's think about this like a medication. And as a physician, like any medication, I would be thinking about what is the safety of that medication first and foremost. So what are the adverse effects? What are side effects? What are interactions? How is this patient going to have this medication interact with their disease process? And then second to that is efficacy. Is it likely to work? And so we're always thinking, is this safe and is it going to work? And we'll go through some of the reasons. What do I want to leave you to leave here knowing? Throughout the talk, I've got a couple of different books, and I'll have them again as references in the end that I think are just really great resources. This one, Cannabis for Dummies. If I had to choose one book, this one is a really great one. It's great for the layperson. It's also great if you have a scientific background in any way. It breaks things down into very digestible parts, and it also covers really everything you want to know about cannabis a little bit. And so this one's great. So what do I want to have you leave here knowing? I feel like I want to have you know a little bit of this Cannabis 101, an introduction to cannabis. Could it be an option for you and your symptoms and your disease process? Could it work for you to help manage those symptoms? How do you go about getting cannabis in a safe, regulated way? And then demystifying the nuts and bolts of it. What are the routes? How do you go to a dispensary? What do you choose? Do you choose an indica or a sativa? Do you use an edible or do you use a tincture? And then how do you figure out what is right for you? Because it's going to take some trial and error. And then I would love to leave time at the end for questions and then any discussion points that people would want to have. So I'm going to tell you a bit of my story. I think if anyone knew me growing up, I would be the least likely person to talk about cannabis that you would ever meet. I grew up in Ohio in a very religious household. I am the only child of some immigrant parents and was brought up in a very strict environment. I very straight-laced, went straight through high school, college, med school, and became a pediatrician. I spent 18 years working in a large academic pediatric center as a hospitalist, which is a pediatrician that takes care of patients in the hospital, and also as a medical educator. I did a lot of work around safety, quality improvement and teams management and communication between doctors and patients. In my medical career as a pediatrician, I solely worked in a hospital, and working in a hospital setting, I became very familiar with children with chronic illness, children with autoimmune disease, particular expertise in children with rare diseases, undiagnosable conditions, and did a lot of work in pain management, palliative care, and end of life. And if there is one thing that I wish I knew more of in my medical career, is I wish I knew more how to treat symptoms for patients, because those are the things that they live with every day, and that's what impacts their life. So my story. I was diagnosed with my first autoimmune disease at the age of 20. I was in college. I was a pre-med taking the MCAT. I was an RA. I was under a lot of pressure, and there is a lot of lay literature and scientific literature about the role that stress has in immune dysregulation. But anyway, I was 20. I was diagnosed with lupus. And then as a third-year medical student at 22, I was diagnosed with polyarteritis nodosa. You thought scleroderma was rare. Polyarteritis nodosa is even more rare. It's an autoimmune vasculitis, which means it's an inflammation of the blood vessels. So I'm no stranger to autoimmune disease. Thankfully and quite gratefully, I was able to have both of those diseases go into remission for about 20 years. And wasn't on any medications. But then I had new symptoms beginning in 2021. And those symptoms were fatigue, poor sleep, malaise, which I love and hate the word malaise. Malaise is the doctor term for the patient describes that they don't feel well. So it is something is not right. I feel off. I feel different. I feel foggy. I feel sick, but I'm not sure how. It's very difficult to describe. And I've had longstanding depression, anxiety, and those things were exacerbated as well. But also, it was 2021. So I wasn't sure, does this mean I've got something else? So I spent several years going to various doctors. The banner there that I've got below are the principles of lifestyle medicine. And so I really tried to dial in, okay, I put autoimmune disease into remission before. I'm going to try to do it again. I'm going to do all the things that doctors tell you to do. And I'm going to really pay attention to nutrition, mindful movement, healthy relationships, really managing stress and like moving through the stress cycle and learning to address my issues, really focusing on sleep. So all of those things that everyone tells you to do, I really, really tried to do it in earnest. And my symptoms were okay. I was functioning, but I wasn't doing well. And then in the middle of 2021, I developed Raynaud's, and I was like, well, that's interesting. People do that. And then finally, my fingers got puffy. So this picture in the center here with the one with the red nail polish on, the red nail polish is my scleroderma fingers. That was my puffy stage, the puffy hand stage. And the one on the right is me now with my normal hands. I had never thought to take a picture of my hands prior to them becoming puffy, so I don't really have a before. The picture on the far left, I couldn't make a fist. I had difficulty typing. I had difficulty writing and holding a pen. And I went to my rheumatologist because I have one of those. And I said, gosh, I think I have scleroderma. And all of my testing at that time was negative. And so for the next 2 years, I just continued with these symptoms. And finally, I was diagnosed in September of 2023. And people often ask, Beth, how did you finally get diagnosed? I finally had my tests turn positive. It wasn't for lack of trying. So I've had symptoms now for about 4 years. And in that time, I've seen 6 different doctors, been seen by multiple different variety of practitioners, and could not get the diagnosis of scleroderma, even when I told my doctors that I had scleroderma. And that process was really difficult. And it led me on this journey of taking care of myself. And it's been a really sad time for me because I really felt like Western medicine, the house in which I was born and raised, really, really had failed me. And so with my diagnosis in September of 2023, I decided to quit my job. I've been a pediatrician for 20 years and felt terrible, as I think a lot of people with scleroderma feel. I felt terrible. Um, and this was my opportunity to save my own life. And I looked at my husband, and I had my two young children at the time of my diagnosis, they were preschool, young grade school. And I was like, I knew that there was something wrong with me. And I said, I finally have a diagnosis. I'm going to get treated. I'm going to take this time. And I also knew, having diffuse systemic sclerosis, I knew what the mortality of that was like, what the morbidity of that was like. And I didn't know because anybody told me, and I knew because I found out on the internet. Um, and that's when I really felt like, wow, I don't know that doctors are telling me what I need to know. They're not telling me that I could die in 10 years, that the survival rate's 25%. Sorry, not that the mortality rate is 25% in 10 years. Um, Again, I had two young children. This picture on the right is a picture of my children at the time that I was diagnosed. And I was like, wow, am I going to leave them? And after diagnosis, I was like, well, that's all right. Okay, I've got a diagnosis. I'm going to get treated. But really, from the time of my diagnosis into September of 2023 until now, my disease was way out of control. And it really accelerated once I was diagnosed and once I started being treated. And I was an excellent patient. I did all of the things. I took all of my medications. I tracked all of my symptoms. I did all of the things everyone told me. But I still really suffered with stiffness that was so bad that I couldn't get out of bed in the morning in a normal way. Like everything, it had felt like rigor mortis had set in overnight, and my body was hard. I could hear my skin, and I could feel myself hardening, and the pain got to the point where it was debilitating. I had nausea from my meds, from the scleroderma. I completely lost my appetite. And I unintentionally lost 20 pounds, and I'm only 5 feet tall. It's substantial. But it really seemed like no one really cared. Um, and even if doctors did care, they didn't have anything for me other than the things that I had already tried. Um, so then I was just in this place of help. And I really came across cannabis in my own pathway through scleroderma by happenstance. So I am Western medicine trained. Look at my two lovely children. No one in my family is medical, but my husband is a physician also. His entire family is medical. And so, of course, we have all of these medical things for my children. And I did everything that Western medicine had to offer, which actually I feel like wasn't much. Medications, lots and lots and lots of different medications I tried. Standard physical therapy, that was not helpful. And then, of course, the standard, well, we can do an MRI, we can do a CT, we can do all of these different tests, and we can consult all these different people, but nothing helped with stiffness, pain, nausea, depression, anxiety, fatigue. And I'm going to highlight fatigue and poor sleep. Nothing was working. So here's what I found. I used all of these things, and I found them all really helpful. And I'm going to zero in on one today. I'm going to zero in on cannabis. So why cannabis? Cannabis, it actually was happenstance. This is again a picture of my hands when my fingers were in the puffy stage of scleroderma, and I couldn't make a fist. And I was on vacation with my family, and we were in California, which was a legally recreational state. And we were with some friends, and I was like, well, recreationally, I'll have an edible. So I had an edible. And my first thought was, oh my God, I can move my hands. And I remember going up to my husband and kind of going like this and was like, do you see this? Do you see this? And this was before I was diagnosed. This was before I was diagnosed with scleroderma, but I really felt like I had scleroderma. And this was at a time when all of my labs were normal, and everyone was telling me that I was fine, and I could not manage these symptoms of the stiffness and the pain and the fatigue were just debilitating. And cannabis worked, and I was like, wow, look at that. It works for my stiffness and my pain, and I felt better. Um, and so I was like, but I don't know if I can use this, right? Like, I live in Utah. I came from Ohio. Like, these are two extremely conservative states. And, I still currently live in Utah, and I feel like I still need to whisper the word cannabis. Um, there's a ton of stigma. Medical providers don't know a lot about it. I tell some of my doctors about it, but most of them I don't. And it's for fear of repercussions and stigma. And I just really came about this from a happenstance way. But why did I end up choosing it? Chronic pain changes you. And a large percentage of the population at some point will live with chronic pain. And acute pain is one thing. When something hurts and it will go away, that is one thing. But when something hurts and no one can tell you why it hurts, no one believes you that it hurts, or no one can tell you what you can do to make it better, or when things that you try don't work and you're still suffering. So I was doing all of the things and my labs were normal, and I felt horrible, and I felt like I couldn't live this way. But my life was going on. I had these two beautiful children to take care of. I was still working full time as a physician. My husband was a physician. I needed to make things work. And so I needed something. And so what I found was cannabis, and it helped. It gave me hope because it gave me relief from symptoms that nobody else could give me relief from. So, what is cannabis? Cannabis is a plant. There are over 500 unique molecules in cannabis. We talk about some of the active molecules, meaning active on our bodies, active on other mammals' bodies, and those are called cannabinoids. So, those are molecules within the cannabis plant that do something on our bodies. They're biologically active. The two that we commonly talk about are CBD and THC. So, both of those are components of the plant cannabis. Those are phytocannabinoids. They are made by the plant. Phyto means made by plants. And then we also have endocannabinoids, which means our body makes them. And why does our body make them? Well, we have a whole endocannabinoid system, which I will get to in a little bit. But so we've got plant-based cannabis. We also have our own endogenous. Our body makes cannabinoids. And there are also synthetic cannabinoids. So synthetic cannabinoids are pharmaceuticals. They are drugs that are manufactured by a pharmaceutical company that are synthetic forms of cannabis. And there are those available in the world on the market. So why cannabis? The endocannabinoid system, so endo again means internal to ourselves. The endocannabinoid system is part of every part of our body. We're only just discovering the endocannabinoid system and understanding what it does, and we're right at the tip of the iceberg. So the endocannabinoid system is a cell signaling system. So if you think of how the cells talk to each other, they talk to each other through chemicals they send out, and then those chemicals hit receptors on other cells, and that's how they talk to each other. And the endocannabinoid system has a major role in homeostasis, which is the balance of internal body functions. And those are things such as mood, pain, appetite, sleep, and immune response. So the two cannabinoids that we tend to talk about are CBD and THC. But again, there are hundreds of cannabinoids. These are just two of them. Up in that top corner are some others. You've got CBD, but you also have CBC and CBG, and you've got THC, but you also have THCA and THCV. You've got a lot of these. So this is a very boiled down version, but CBD is non-psychoactive and THC is psychoactive. So you can legally buy CBD in all 50 states. It is, again, not psychoactive, but that doesn't mean that there aren't effects, because again, those receptors exist in other places. And just because it's not psychoactive means it's not activating the receptors involved in the nervous system. But CBD has incredible properties, being anti-seizure, antioxidant, anti-inflammatory, anti-cancer, and minimal side effects. There are, I can't, when you look at published literature, people will say no side effects. But the side effects are kind of like whatever you would expect with taking anything. So nausea, um, that's probably the biggest one. It has limited interaction with other things. You cannot overdose on CBD. You could drink an entire bottle of CBD and you cannot overdose on it. The same is true for THC. So even though it's psychoactive, it has no receptors that are involved in breathing or hurt. So it cannot depress your breathing like other medications used for pain can depress your breathing. And THC, because it's psychoactive, also has a lot of those other psychoactive symptom components. So it can be relaxing or sedating, but sometimes it can be stimulating. It's anti-nausea, stimulates appetite, and it's very well tolerated at appropriate doses. And so I have a scale there, and I also have a Venn diagram. And so when thinking about this, I want people to think of mind of a scale of just the balance of the two, and then also a Venn diagram being there's overlap. So evidence that cannabis is useful in treating so many things. So there is actually really good evidence, and this is from the National Institutes of Health, that there is evidence that cannabis is useful in treating. I'm going to highlight the two diseases at the top, multiple sclerosis and rheumatoid arthritis. Those are very similar to scleroderma. When people haven't heard of scleroderma before, I say, well, have you heard of multiple sclerosis? I have systemic sclerosis. And so it's that sclerosis part is there. Chronic pain and opioid dependence, nausea, vomiting, particularly that associated with chemotherapy, as well as cachexia and appetite stimulation. So cachexia is complex, but it is when there's involuntary weight loss, muscle wasting, fatigue. And so those are often really difficult to manage. It's been studied in HIV/AIDS patients and cancer patients, but poor appetite is associated with many different conditions, and weight loss and digestive issues are particularly common in scleroderma. And then epilepsy. I professionally have taken care of many, many children with intractable forms of epilepsy or epilepsy that's refractory to typical treatments for epilepsy. And I've seen children get better with CBD, which is, the active ingredient in Epidiolex, which is used in the United States for the treatment of seizures. There is some medical evidence in scleroderma. I was looking and I found a case report of a 72-year-old female patient who had chronic pain secondary to osteoarthritis and scleroderma and scoliosis. And this was a report of them using cannabis to decrease her opiate use. And what they found was when they started this woman on a protocol of medical cannabis, she was able to decrease her use of opiate pain medications. And I love this statement that they said in the end. Chronic pain is a common diagnosis that patients may face, resulting in increased morbidity and mortality and affecting the overall quality of life. In addition to established multidisciplinary pain management, medical cannabis may offer an approach to improving pain outcomes and functionality. And if you leave here with anything, I would like to leave you here with that. So there is evidence for the skin. There's cannabinoid receptors on fibroblasts. Fibroblasts are involved in wound healing, and that's a really big part of scleroderma, is wound healing, excessive fibrosis. Cannabinoids also suppress cytokines, which are, again, chemical mediators in how cells signal each other that inflammation is present. Those cytokines are things like TNF-alpha and interferon. Other medications that are used for autoimmune disease block TNF-alpha and interferon in these cytokines. Well, cannabinoids also suppress them. So that's where I'm going to end on talking just about like the pharmacology of cannabinoids, because the National Scleroderma Foundation has a great repository of information, particularly their YouTube channel. And so if you go to the National Scleroderma Foundation and you put in cannabis, and you will see some lectures. And I'm going to particularly highlight these two lectures given by Joanna Harper, who is a pharmacist and also a really great speaker. She's got two 1-hour talks available online from past presentations where she goes into detail about cannabis. So for time, because I'm realizing now I'm gonna run out of time to talk about things people probably want to hear about, is the nuts and bolts about it. So I'm gonna go through this. So you're thinking of trying it. Start low and go slow. You're gonna need to do some trial and error, but I want you to do it in an educated way. So I'm gonna go through how to access it and how to get it. So here again is that legal map. I encourage you to think about the state in which you live. And what I like about this map is that it shows you in the green, those are the states that it's legal for medical and adult use. And so in the green states, cannabis is available to you for purchase if you are 21 years of age and older for recreational purposes. And so I'm saying recreational. Recreational and medicinal cannabis is exactly the same. It's the same product. It's just where you buy it. In the states where it is red, it is available. You just need to get a medical card. And I'll go over the ways to get a medical card, which is actually pretty simple. And even in the restricted states, which are the orange and the yellow, those states you are able to purchase limited amounts of THC. And then in all 50 states, you can purchase CBD. And we have talked a bit about the properties of CBD. And so you can do that anywhere. So if you live in only a medical state, here's what you need to do. Check your state laws. This is a quick Google. So you're just going to Google something like Virginia and cannabis laws. Confirm your eligibility. So on the state's website, you'll need to be a resident of that state. You're going to need to have a qualifying condition. And these vary widely from state to state, widely. But now in 2025, the conditions included, it's very vast. And so common conditions that are qualifying often include chronic pain, nausea, vomiting, cachexia, which is again that weight loss associated, involuntary weight loss associated with disease. Rare conditions is also listed. And then there are a lot of other ways that you can obtain cannabis, particularly things like PTSD, cancer, and multiple sclerosis. So you're going to look for a qualified medical provider. On the state's website, often they have a list or a link to qualified medical providers in the state. You can also Google qualified medical provider and list your state. Often there's a variety of people who can be providers. Those are physicians, but you can also have qualified medical providers who are nurse practitioners and also physician's assistants or PAs. Check your state's websites. Also ask around, ask for other patients, ask your doctor, ask pain specialists, ask therapists, ask around, and then getting your medical card. This is actually really easy. So you're going to make a visit with that qualified medical provider. So you're going to schedule a visit. Often these can be done in person or virtually. You're going to bring your government issued ID, and you're going to bring any medical records or allow your provider to have access to medical records so that he or she can give you some recommendations. During your evaluation, they will probably go over qualifying medical conditions and if cannabis is appropriate for you. And I will let you know, having done the training for qualified medical providers and actually, working as a physician, most doctors don't know a lot beyond, are you able to get that card or not? And it's just a lack of knowledge. There's a big gap there. And so just because someone is a qualified medical provider, they may not be able to give you recommendations on what to use, when to use, doses, routes, strains, etc. So after you see that qualified medical provider, you're going to apply within your state, and then you'll get a card. It looks kind of like a driver's license. It often does not have your picture on it, though, but it might. And then with that card, you can go to a medical cannabis dispensary at a state licensed facility and purchase things within legal limits of your state, which are generally very generous if you are a patient. And so if you live in a state where it is available both medically and recreationally, well, if you are 21 years of age or over, I would say check out some dispensaries. How did you do that? Look at websites, look at products. You're purchasing a product, and so be a really thoughtful consumer when you are doing it. One of the things that I have people pay particular attention to when they are looking at a cannabis dispensary is who's on staff. For example, I live in the state of Utah. In the state of Utah, every cannabis dispensary has to have a pharmacist on staff. And so you can go and talk to a pharmacist. The people who are definitely there are people who are called bud tenders. And so that is a play off bartender. So these are bud tenders, as cannabis is a flower, and so it's got buds. And those are staff. There's a wide variety of training or lack thereof in the cannabis bud tenders. Some are great. Some are incredibly knowledgeable, really passionate, have a lot of knowledge about dosing, routes, and strains for different medical conditions. And some are there to sell a product. And so I think looking at your dispensaries and who and what is available at that dispensary, pardon me. Dispensaries also have different programs that they offer. A lot of times they will have patient education. I was looking at our, pardon me, dispensary near us, and there was a whole educational hour on cannabis and autoimmune disease. And I was like, oh my gosh, this is amazing. And so often these places will offer free education as well. I'm going to say it one more time. Start low, go slow. And we're going to go through the different routes. So when visiting a dispensary, thinking about what do I want when I'm taking this medicine? Am I using it for sleep? Am I using it for pain? Am I using it for nausea? How fast do I want it to work? and how fast do I want to come off? So how fast do I want it on? And how long do I want it to work? And that's where it's really going to help you with route. So start low and go slow. And as I am coughing here, I am reminded, as many of you all know all too well, scleroderma is associated with lung disease. So inhalation is often not a route that people want to go, and that's completely fine. And actually just take it off the table. There's lots of other things. So we'll go through the different routes, but I think the biggest thing to take away from this slide is the far right, the duration of effect. And so onset and duration matters. And you can see it goes from shortest to longest. The quickest onset is with inhalation. It's going to be minutes. It says 7 to 10 minutes, I would say. Often that is seen even sooner, so within seconds to minutes. And then duration can be shorter, can be, half hour, 45 minutes, up to 3 hours. So if you are not thinking about inhalation, totally fine. We could take that off the table, as many patients with scleroderma do not want to do an inhaled method. I will say a lot of people do like that method, though, because of the rapid onset, particularly things like nausea and pain, and where you don't want to wait for the effects to happen, because the other most common route is down at the bottom, ingestion. So those are edibles, capsules, tinctures, sprays, pills. It's slower. And so depending on what's in your stomach, it can be, half hour to an hour, or it could be 3 or 4 hours, depending on what is in your stomach and how much there is. And then the duration can be longer too. And so when you think about what is your desired effect, think about the timing and onset and duration, and that'll help you with route. So let's talk about inhalation, smoke versus vapor. I had to think back to like high school physics and like, what is the difference between smoke and vapor? Smoke is when something is burned and there is combustion that happens. And so that's the typical, you light a joint and there is smoke and you inhale the smoke. And that is what people typically think about when they think about cannabis flower, either using it with a joint, a bong, a pipe, something else to smoke it. A vaporizer. So the difference between smoke and vapor is heated to a lower temperature, and then vapor evaporates. And so think about water. Water evaporates when heated, so it's steam. So when you're thinking of vaporizing flower, you're putting the cannabis product into a chamber where it's heated by an oven to a point at which the liquid elements boil off and you inhale the steam. Basically, generally vapor, whether it comes from a dry herb vaporizer where you're heating the herb, or if it comes from a pen type vaporizer device where there is an oil chamber and you are vaporizing heated oil, that does not produce smoke. It does not have as much smell, but it does give you that quick inhalation onset and off. So the pros of inhaling: it's fast on, it's fast off. So it's much easier to dose and titrate. You're going to know quickly whether you like it or not. And if you don't like it, it's going to be off really quick. The cons, of course, are, lung health and the smell, and it's not very discreet. So what's the next most common thing people use? People use edibles. And edibles come in everything. They come in food projects. They come in gelatinous cubes. In a lot of states, they come in these gelatinous cubes because they're not allowed to be sold as anything that looks like the shape of a candy, so as to not be marketed to children, type of situation. But it also comes in things that look a lot like medication, so tablets, capsules, and there's even now cannabis beverages for people who want to sip their cannabis, much like other people sip alcohol as more of a social lubricant, I guess. So the pros of this: it's very discreet. Right? So no one knows if you're taking a medication, if it's a medication or if it's a piece of candy. The cons, though, the timing and onset are very, very variable. And so really pay attention. And so I tell people with edibles, start low, go slow, like with all things. And I suggest for people, try on an empty stomach, because then you're going to compare apples to apples the next time you try it on an empty stomach. When you have food in your stomach with any medication, it is likely going to delay the absorption. So that actually might be really beneficial. If you have a full stomach, the onset will be much slower, but then the off will be much slower as well. And then tinctures. I actually think tinctures are a very underutilized, but also and very beneficial route, because it bypasses the metabolism that takes place when you eat something. So when you take a pill and it needs to be digested and bypassed by your liver, tinctures are absorbed in the mucosal tissue. So that kind of slippery, squishy tissue on the inside of your mouth. The hardest thing about tinctures is making sure you take them correctly. So tinctures are generally made of a cannabis extract. So they've taken the plant and extracted some molecules and made it into a liquid. You need to put it under the tongue or inside the cheek, which is called the buccal mucosa, and allow it to sit there. And then it gets absorbed into the tissue in your mouth, much like sugar would if it was left there to dissolve. The onset can be within a few minutes, which can be really helpful. And this is also another great option for people who don't want to inhale. And then topicals. Topicals are great because you apply it directly to the site. So if you have knee arthritis and you can apply a topical directly to that site, that's always much better to get pain relief from a topical application than it is to go through systemic absorption, something that affects your whole body. The con, it's not that well absorbed, so you won't get systemic absorption. You'll get a little, but probably not enough to feel systemic effects. But it's great, again, for a local option. And then patches are something that's kind of new on the market. And that patches, like transdermal patches, kind of like contraceptive patches or other types of patches like pain medication patches might be an option in the future as well. Okay, so now you're at the dispensary and it is dizzying and you're paralyzed by choice. And you're like, what do I get? Let's go back to those questions again. What do I want this for? And what is my route? And now we can get into a little bit of the nitty gritty. I'm going to tell you some of these terms here so you can have a conversation with the bud tender or the person who is working there and really get what you want. So strains. Let's talk again about CBD and THC, the non-psychoactive and the psychoactive properties. Really, what I want to focus in here are the ratios. So ratios, this is often from an extracted product because you can't really get ratios and dial them in when you're using a plant. So inhaling smoke or using a tincture-based product, thinking about that from the ratios. So CBD to THC, and those come in a wide variety of ratios, 1:1, 3:1, 5:1. The sky's the limit. So thinking about that ratio is really important. A quick note on spectrum. You'll see these words like full spectrum, broad spectrum, and isolate. So full spectrum means that the whole plant has been used to make whatever it is. So a tincture, an edible, a salve, it used the whole plant. And so that means you're getting all of the cannabinoids that are in there. So CBD, THC, plus all the other ones. Broad spectrum means it's the whole plant, but then they took out the THC. So it's not psychoactive. And so these are also really great options. So a broad spectrum minus the THC is not going to be psychologically active, but can be very useful from all of the other cannabinoids that are in that isolate. Sorry, I just said the word isolate because I was looking at it. And isolate means it's just one compound. Strains. So you may have heard of this, sativa and indica. Sativa, I think of as stimulating, and indica, I think of as indicouch, relaxing. There's a lot of crossbreeding in there. So these are just different strains of the same plant. And so again, I've got that Venn diagram in there. And the sky is the limit with the different types. You've got lots of different strains and a variety of hybrids as well. And then a quick note on terpenes. This is for people who are getting into the nitty gritty and that really want to get into cannabis. And so thinking of terpenes, terpenes are what give cannabis the aroma. Think of it as like the flavor molecules that you might smell in coffee or wine. And I'm going to have a special attention to this second to bottom effects row there. And so you can see that all of these different terpenes have slightly different effects, right? Some are uplifting, some are sedating, some are relaxing, some help you promote memory and alertness. And they have different strains. And so if you are able to smell it and you like want to get into it, I tell people, smell it. If you like the smell, you will probably like the experience. If you don't like the smell, you probably won't like the experience. And let's talk about the entourage effect. So we've got all of these things that we find in nature. So let's think of the opium poppy. You've got a poppy, but then you've got all the way, you've got opium, you've got morphine, you've got all the way to like fentanyl, right? You've got all of these different things. And the entourage effect is the theory that all these different compounds in the plant work together and they enhance each other's effects much more so than each of these individually. So it's their synergy of it. So you can have cocoa and sugar and flour, but together in synergy, you can make a chocolate cake. And then that is very different product than the sum of its components alone. So what you need to do is you need to read the label. Here's an example of a tincture. And I'm going to highlight right here. So this is a 25:1 CBD to THC tincture. So you are going to have a really high amount of CBD and a low amount of THC, which is great because again, THC is the active component. You're going to get a high anti-inflammatory and a very low THC. At that much THC, when it is with that much CBD, the THC effect is really minimal. And so in order to minimize the THC effect, so if you don't want to have that high experience, have at least a balance of 1-to-1 CBD THC, and the more CBD to THC, the less of a high that you will experience. So here's another example, and I apologize for going quickly. I just want to save time for questions. So here you're like, you know what? I would like to try some gummies for sleep. And here's what I got. So this one has total THC per serving, and so that's going to be per 1 cube, 9 milligrams of THC, 9 milligrams of CBD, and 9 milligrams of CBDN. So, okay. And with the start low and go slow, you can always cut these in halves, cut them in quarters, and try just a small amount. And here's one more. I'm going to try to compare these edibles. And so these edibles, let's see, we've got one for sleep, one for balance, and one that says active. And they've got these different routes, sorry, not different routes, different ratios. And so when you're using products that are derivatives, so tinctures and edibles, they are often labeled for you. This one's for sleep, this one's for active, this one's somewhere in the middle, and that can also be really helpful. So examples, again, this is not medical advice. If you just want to start with something very benign, a little dip in the water, if you will, topical CBD. Topical CBD won't get you intoxicated. It won't interfere with anything. And then you can go all the way up to using things. I would always tell people to use a balance of CBD and THC because that's going to be the best, most balanced effect. A good tip is if you do have too much THC, if you do feel like you are too high, or you don't like the effects, having CBD in alone on hand, CBD will counteract those effects very quickly and outcompete the THC receptors and bring you down from that psychoactive component. And titrating, it's going to be some trial and error. Start low, go slow, trust your body, try different things. And also it may not be for you, and that's okay. Don't give up. There are other things. Let's, just keep working with your providers. I'm going to stop there. I realize I probably ran over time, but it looks like we've got 12 minutes. And I'm going to leave these here. The top 2 books I think are great lay people books. They're easy, they're digestible. It's something you can just bring with you to the dispensary and just show the bud tender what you're interested in. The bottom 3 books in the white there, those are great medical books that actually are written by physicians, and they go into different doses, routes, and strains for different conditions. And so if you are a medical provider, if you are interested, these are great textbooks, especially as reference. And with that, I will pause right there and see if anyone has questions.
Thank
Wow,
you
there's
so
so
much,
many
Dr.
questions.
Vukin. Yeah, we've got several questions in the Q&A and a few in the chat. I'll go ahead and start reading them off for you. But fantastic presentation. So the first question we have here is, do you know if THC in marijuana affects your circulation? Because this is often a big problem with folks living with scleroderma.
Yeah, that is a really great question. And I think one of the reasons why many physicians are lobbying, the people who are lobbying for it to be descheduled or deregulated, is so that we can actually study it. It's really difficult to study effects. But what we do know is that it can be a little bit of both. It can be a vasodilator and it can be a vasoconstrictor. And some of that does have to do with dose. Like a lot of different things. It can vasodilate at a certain dose and it can vasoconstrict at a certain dose. And everyone is different. I'll say, just as my own personal experience, for me, it's a vasodilator. And for me, honestly, it helps with my Raynaud's. I don't know if it'll help for everyone's Raynaud's. I know it helps for mine. And so I think that is something to really be thoughtful about in talking with your physician. A lot of people with scleroderma, myself included, are on medications that can lower their blood pressure because of the vasodilatory effects. And a lot of people with scleroderma also have high blood pressure and can be on other medications for that too. There are cardiovascular effects, and I would suggest talking to your provider. There can be effects, and we don't know exactly. Yeah.
Oh, fantastic.
I'm seeing these muscle cramps and
yeah. And this next one is related to kind of that brain fog that is often associated with scleroderma. So since scleroderma can affect cognitive abilities, does long-term THC use compound that issue?
That is a really great question. And so I'm going to start with like the population that I know better, which is kids. So I'm going to say that even though I'm a pediatrician and that cannabis is used in compassionate care in pediatrics for a lot of different things, the effects of cannabis on the developing brain, we do know that there are dramatic changes that happen in the developing brain with cannabis, as with a lot of things, right? Things are developing for the mature brain. So I'm going to say above the age of 25, your brain is kind of formed in its adult pattern. Um, there are less cognitive effects, but there are cognitive effects, right? So, same reason you don't drink and drive, you shouldn't be intoxicated and drive. There are some effects, and the literature is very mixed, right? So there are some studies that say that it impairs cognition, impairs short-term memory, and there are some studies that say it improves executive function, increases focus. I think that's very variable, and I think of it as like the same medication is used for some people for fatigue as for energy, which is very strange to me. I think that it is most common that people find, when I hear people talking, what you hear lay people talking about a lot is using it for sleep. But for some people, they find it very energizing. I'm going to say for myself, my cannabis helps my fatigue, and it's the only thing that's helped my fatigue. And I say that completely as a patient, again, not as a physician, sharing my own story, not medical advice, but it helps my fatigue, and it's the only thing that helps. And I think for fatigue, that's one of the things that's really challenging in scleroderma. Stimulants are often contraindicated because of the blood vessel disease. Stimulants cause blood vessel constriction. There's just not a lot else. So I think the people who I think the literature actually says the people who get the most benefit from cannabis are people who are like over the age of 50,
Mm.
which I actually think is really great. It's like your brain's like is what it is, and their brain seems to be able to like use it in an appropriate way, and it's not like developing, if that makes sense. And yeah, now I'm
Well,
just talking.
very
I'll
good.
let
Yeah. No, and we have another here. Has there been any evidence that you know of or research about the efficacy when it's related to muscle cramps or anything like that?
That's a really great one, and I will again like I'm a patient. I'm just going to tell you mine. I had terrible muscle cramps. I had poor perfusion to my muscles, as evidenced by an elevation in my muscle enzymes that improved with improved perfusion. Um, it helped me, and it's like one of those things where now I just feel so passionate about talking about it because it helped me. It helps me with like a lot of these symptoms. I in kind of reading for this presentation, I didn't find anything in the literature to for muscle cramps. There were things for muscle pain, but I think that is that pain from a cramp or is that pain from something else? um, and so I think it again is one of those things that you could try and see if it's helpful. There's some evidence that cannabis is more biologically available if you have increased circulation. So people have used it for athletic performance and say that when they use cannabis with their athletic performance, they have less fatigue, less muscle cramping, for what that's worth.
Oh. And we have another here. Any worries about THC slowing down the vagus nerve and slowing down GI contractions or just making it worse
Mm.
for folks who have a slow motility system?
Yeah, that's a great one because motility really is a big issue. I, in my reading, did not come across anything for motility specifically, but the reason that people think that cannabis works is a variety of different things. And so when we think of things for motility and nausea, there are receptors in the stomach and there's also receptors in the brain. And so, like, it's your brain and your stomach that's kind of digesting your food and causing peristalsis and the symptoms that you experience with like nausea. Um, and so I would say I don't know that there is or is not any evidence for motility, but that it is a very successful agent in treating patients who have nausea, vomiting, poor eating, weight loss secondary to it. And so whether that increases motility, it increases appetite, decreases nausea, it's kind of hard to know.
Absolutely. And there have been a couple questions kind of related to dosage levels. So,
Mm-hmm.
one question is asking kind of simply, what doses do you take? Another is an example of an individual who's had scleroderma for 9 years. They're in their early 70s and they've never done this before, but they're interested in
Yeah.
gummies and kind of where should I start? Maybe is kind of the questions
Yeah.
that are coming in.
That's a great question. Start low, go slow. Low. low. And so I'm going to talk about THC because THC is the one that people worry the most about because it's the most psychoactive. And be really careful in dispensaries because cannabis is now an industry, right? People are making money, and people who use cannabis regularly want high THC because they have a tolerance. And recreationally, people tend to want the THC. I would say for autoimmune patients, you really, really want the CBD. So I'm telling people like use CBD and high doses. It's kind of crazy. Like you really do need to use higher doses of CBD than you would think. So 30 milligrams of CBD, 100 milligrams of CBD, 200 milligrams of CBD, which sounds like a lot because when we talk about THC, we're talking 1 milligram, 2.5 milligrams, 5 milligrams of THC. For a new user, I would not go above 5 milligrams of THC. That is plenty. You probably are going to have to cut things. There's definitely, things that come in smaller amounts, but try really, really small amounts. And so again, higher doses of CBD are the ones that are needed for anti-inflammation, 30, 100, 200 milligrams of CBD. And then THC, if you're going to use them separately, 1 milligram, 2 milligrams, 5 milligrams, but I wouldn't go any more than that. And then there's going to be a combination of products. I would always encourage people to use CBD in combination with THC. That tends to mitigate the side effects of each. They tend to balance each other a bit more. Bud tenders can really, really be helpful, especially for, our gentleman who says he's, 71 and wants to try gummies. Say, what I would say is go to the bud tender and say, here's me. I have, these conditions, if they're important, and say, I'm really looking for something to help me sleep. And they can be really beneficial in that route. And we just have a
That's
couple
hugely
minutes
helpful. And I
left.
think a really good point about the difference between the CBD and THC and those in the milligram amount. Like that's a huge takeaway, I think, for the audience. Um, in a quick follow-up on that before we jump to another question, we had something pop up here for 30, 100, 200 milligrams. How many times per day would you say if they were going to do
Oh,
a dose
yeah.
like that?
Yeah. And I think when you're dosing in milligrams, you're probably taking that as an edible, right? Like, or a sublingual tincture. So think about how much in a day. And I think that's where, so with CBD is really, I don't want to say it's benign because that sounds right, but it's there's a wide therapeutic index, or sorry, what am I trying to say? A wide therapeutic window, which means you can dose that quite high and not get into any trouble. And then with how many times per day, it's really dosing to effect. And gosh, like the ones that are oral, think of them more like a pill and they last a long time. So if you take an edible and it lasts between 4 and 8 hours, let's say, that's kind of like an ibuprofen, Tylenol sort of situation. And so you can take that as needed. If you're using it for pain and you have continuous chronic pain, I would say dose it multiple times a day, right? Dose it twice a day, 3 times a day. But if you're using it for something more like sleep, well, then just dose that at nighttime. And you can even try with just dosing CBD at nighttime. If you're like nervous about THC, totally fine. Start low, go slow, and you can always ramp up. And then keep good notes because everyone is very different. Again, for me, THC is very stimulating. I use it for fatigue, but for others, completely sedating. They'll have 1 milligram of THC and be asleep for 12 hours. And so I think you need to, when you're using it, make sure you're in a safe, controlled environment. So hopefully if there's another person with you, that can be really helpful, and that you're in a safe place. Don't drive, don't operate machinery, don't use it with other substances, don't mix cannabis with alcohol. Oh, and average cost, wide
Yes.
variety. It's like everywhere, so much. But I would say a lot of places, well, you can buy small amounts, right? You can buy like a pack of 3 gummies or like, things like that.
Fantastic. And we are right at the hour. I know we had a ton of questions. Thank you, everyone, so much for joining us. This has been recorded, and Dr. Elizabeth Vukin has been kind enough to share her slides. So, in a follow-up email on Friday, I'll include a link to the recording and a link to a PDF of the slide deck, so you can kind of review. Dr. Vukin, do you have any parting comments for the audience?
Well, I just see these two things that I want to like say
No,
something
go
to.
for it.
So
Go
I
for
see
it.
the neuropathy and is sativa contraindicated. Oh, sativa contraindicated in scleroderma, that's a tricky one. And I would think it might be because of the stimulating effects. People worry about that, but the stimulating effects are not due to like vasomotor tone. Like without getting too medical into it. And that a lot of things are crossbreeded now. I don't think that anything is really contraindicated in scleroderma because I don't know if we know enough to contraindicate something in scleroderma. And then the one thing, CBD help with neuropathy, yes. So I would say that neuropathic pain is one of the pains that's most difficult to treat, and that CBD and THC are both really effective and helpful in neuropathic pain as well. I guess I just want to say thank you, and to kind of show people like a face of someone who I think had like a very relatable experience with scleroderma. Like I'm a mom. I was just trying to use something to help me feel better when I found that nothing else helped me. And so I appreciate people's attention and their interest, and I hope they seek out medical attention and providers that can help them where they can.
Thank you so much again, Dr. Elizabeth Vukin, and thank you everyone who took some time to join us today. I hope everyone has a wonderful rest of your day. Take care.
Thank you.